The concept of abrading the skin is not new. As far back as 1500 BC, Egyptian doctors used a version of sandpaper to smooth body scars. In more recent history, a gadget consisting of rotating wheels and rasps were used by Kromeyer in the very early 1900s in Germany to remove top layers of skin. Later in the 1950s, motorized machinery was introduced, and as such, early forms of dermabrasion were born. Dermabrasion was riddled with problems that included excessive pain during and after treatment, the need for anesthesia, lengthy recovery times, frequent scarring, complicated wound care, and a high risk of after-treatment infection. While microdermabrasion is not a surgical resurfacing tool, it has its origins in surgical resurfacing procedures such as dermabrasion. The first microdermabrasion machine was developed by Dr. Mattioli and Dr. BRUTTO in Italy in 1985. Early microdermabrasion machines were simple, but had several issues. The machines were created as open systems, which meant the clinician poured the crystals from a container into the machine and discarded the crystals by letting them run into a waste receptacle. The open system was a challenging one for two reasons. First, the crystals could easily spill out, and the dust might land anywhere in the treatment room. Additionally, at one time there was worry about the aluminum oxide crystals and their ability to precipitate Alzheimer's disease in clinicians or clients who inhale the crystal dust. This was disproved, but aestheticians are still strongly encouraged to wear masks while performing microdermabrasion. These earlier models were quite different from the aerosolized machines of today. There are many different microdermabrasion machines available on the market today, more than 100 at last count. But essentially, they all have the same basic design concepts, acting as an electronic vacuum for the skin. The machine effectively distributes medical-grade crystals across the skin's surface through a stainless steel or glass wand, which is called the handpiece. Microdermabrasion machines are simple units that use vacuum in conjunction with crystals to exfoliate the patient's skin. Using a machine that is functioning properly is important. The microdermabrasion machine and how it is used has effect on the treatment result. Improper operation of the machine could injure a client or the esthetician. The most common mistake made is the depth of treatment, which is controlled by the force of the crystal flow, the speed that the handpiece is used on the skin, and the number of passes made.